My name is Barrie Tan, and I was a University of Massachusetts professor for 10 years before I started my career on this. And my background is working with chemistry and biochemistry, and then I segue into food science and nutrition. And now in my latter years, doing a nutritional study and what a nutritional supplement, how it may benefit human. When I discovered that triglyceridemia precedes glycemia, I decided to went all in for people with fatty liver disease. I took that step because as an organ, the liver is the largest organ. So I decided to study fatty liver disease. Sometimes people say the skin is the largest organ. Skin is the largest surface organ, but not by weight. By weight, it will be the liver. Think for a moment. So I'm talking about fatty liver disease. Americans are having cirrhotic liver. Unlike 30, 40 years ago, where cirrhosis came from overuse of alcohol. Now, people have cirrhotic liver. We call it NAFLD, non-alcohol fatty liver disease. Can you imagine that? There is actually a name of a disease that excludes something. I nicknamed this. I call it FASO, F-A-S-O. It's fat and sugar overload. That's it. Who would have guessed? 40 years after, we have 100 times more people we have really bad declining liver, like people who have liver from alcohol destruction. You think about it. Alcohol in large amount destroys the liver. We know that. But high fat and high sugar can destroy the liver like alcohol. That is hard to stomach. So therefore, this product that Xtendlife have is, I consider, very time appropriate. So why and when do we take care of the liver and the ingredients that matter to it? I can list 4. 1. Vitamin E delta tocotrienol, choline, Reducose, and milk thistle. And I explain each in simplicity what they do. Vitamin E tocotrienol I covered a little earlier. This is an anchor, so it directly addresses fatty liver condition, and fatty liver condition is caused by dietary concerns. And in the addressing of fatty liver, it reduces oxidation, it reduces inflammation of the liver, it reduces the enzymes that are stress liver enzymes, and it reduces fat in the liver, which is called steatosis. And if the fat is uncontrolled, eventually you'll have scarring tissue. Scientists call this fibrosis, so it reduces fibrosis. And finally, if the liver cell dies, and the vitamin E can help to reduce the apoptosis, causing it to die less. So to summarize, reduces oxidation, inflammation, liver enzymes, steatosis, fibrosis, and apoptosis. Next, choline. Choline is a key metabolite. The liver loves to use choline to make many fats and many structures in the liver. So I call this choline a companion metabolite, a companion for which the liver to do well and excel. So it doesn't prevent this do that, it just needed to make many things. So it's a companion. Reducose. This is extract from mulberry. It inhibits the enzyme that digests carbohydrate, meaning that it would slow down the glycemic index and you would not have sugars spike. So that is as simple as I can put it. Milk thistle, the last one. The key ingredient here is a polyphenol called silymarin, and this reduces liver damage or liver toxicity. So when you think about milk thistle, you think about reducing toxicity. What would be some example? It would be like lead, mercury, pesticide, PCBs. Long time ago, the government banned the use of PCB because used in transformer, in paint, in anything that protects these users, but it causes severe liver damage, and so milk thistle is to prevent that. So now I have described to you the 4. When to take it. Now the when to take it has a nuance. Before, I would say that adult greater than 25 years old, perhaps with a BMI overweight, that is 25 to 30. Now this have reduced to adolescent or greater than 15 years old, BMI same, 25 to 30. Because the BMI is greater than 30, then that would be needed. Notice that when I use the word BMI, it's not referring to liver toxicity, liver damage like I mentioned before for milk thistle. Well, this is when the star and the anchor comes in for DeltaTocotrienol. This is for people with fatty liver disease, which means my acronym FASO, FASO. This is fat and sugar overload that affects 90 million Americans. This fat and sugar overload leads to fatty liver disease, and this is not exactly as in the liver toxicity that milk thistle does, but instead this is for people who would have fatty liver, and number of people with fatty liver far exceed people that have liver toxicity. The key ingredients are vitamin E tocotrienol to address fatty liver disease. Second, milk thistle. This will address liver toxicity. Third, choline. This would be a true companion of metabolite to the liver. And last, Reducose, and this will control the glycemic index because it controls how the carbohydrate is broken down to sugar. And yes, I would recommend Xtendlife Total Liver Care product.